Exactly 9:22 a.m. on this Monday morning. And our next guest is Mohamed Hoosen Suleman. He's a fourth year medical student at Nelson Mandela School of Medicine, University of KZN. Of course, he is also a summa cum laude pharmacy graduate at UKZN. He's won multiple awards and accolades during his medical career. He's recognized as one of UKZN's top medical students. So we are honored to have him in studio with us this morning to talk about a very important issue, and that's COVID-19. But before we get there, I also need to tell you that Mohammed serves on the student run simulation of the World Health Organization. He also serves on the Trainee Advisory Committee for the Consortium of Universities for Global Health. And as I've said, he joins us today to discuss what the year might look like with the current pandemic and how things may change, inshallah. Assalamu alaikum, welcome to the program, and congratulations on all your achievements. I think you do us as a Muslim community very, very proud. Wonderful to have you on the show this morning. Welcome.
Wa alaikum salam. Um, Thank you so much for the kind words and for that kind introduction. Um, Thank you so much for the invitation.
Lovely to have you here. Let's pick your mind, let's pick your brains. Undoubtedly, you would be able to give us some possibly uh, good news regarding the pandemic, how it's going to be playing out. Hopefully, it's now. We I'd like to think we're on top of it, but let me start at the beginning. We kind of are observing a general decline of the COVID-19 infection rate, and that, of course, is not only. Does this, in fact, mean that we've passed the fourth wave of infections? What do the numbers look like currently?
Indeed, that is so because when you look at all of the indications, they reflect a downward trajectory, and we seem to be coming out of this fourth wave of infections. But it does not mean that there's no transmission of the virus. There is community transmission. And our positivity rate, so it's roughly 10%, meaning that 1 in 10 of our COVID-19 tests is positive. So there is spread of infection, but it's under control. And if you look at yesterday's national increase, it was about 2,500 new cases. And so when you compare this to the other countries, South Africa is in a good position now. And I think it's a good start to the year. But when we look closely at the data and we see that how many people who are positive progress to severe disease and death, and our fourth wave shows an average of 150 deaths per day. And you compare this to our third wave, which showed about 350 deaths per day.
Okay.
South Africa's second wave showed about 600 deaths per day. So we clearly see how less severe of a fourth wave we've had. And so we aren't seeing a very severe form, or we had not seen a very severe fourth wave. And I think 2022 will show how we have learned to live with this virus and to carry on with our everyday lives.
I have a few, about four more very important questions to put to you, but just on the top, from the top of my head, I'm kind of wondering what's going to be in store for us come the winter months in South Africa. We know what's happening in the Northern Hemisphere, where they are obviously going through their winter months, and things pretty dire in that part of the world. Given this really positive picture that you've painted, do you think that inshallah we kind of pass the very critical, serious phases of COVID and Omicron?
I think absolutely, because if you look at the new variant, in particular, it's proven to be highly transmissible. In fact, it's the most transmissible of the variant that we had seen, and it's attributed to the number of mutations. It's the constellation or the buildup of the mutations in the SARS-CoV-2 strain. Um, in fact, they've shown it to be it's a total of 52 mutations that were identified. Um, and when you compare to the Delta variant, which had approximately 30 mutations, but in particular, you look at the receptor binding domain of the spike protein in Omicron, 10 mutations, and in Delta, 3 mutations. So we can see how the extent to which it's different, which affords an explanation for, um, for the transmissibility. But the issue of a more severe disease, and I think in the winter period, we could potentially see a spike in the infection rate. But yeah, but the question that will we see a severe form of the disease? And I think no. I think that in the last 2 years, we've been through the worst. And I don't think that we'll see any more of something to be concerned about. But we could attribute this also to a certain level of immunity within the population. It's either through vaccination or through natural infection. And and the study towards the end of last year, it was a seroprevalence study, showed that about 70% of the country had already been infected. And of course, it includes the asymptomatic infection cases. So I don't think that we'll see more of a severe form of infection.
Inshallah not. Now, Mohammed, we know that the current Omicron is said to cause mild infection. However, the World Health Organization has warned us not to treat it as a mild infection. What exactly are they saying to us?
Yeah. So you see, when it's a mild infection, that's from our preliminary information. And so, as I've said, that if you look at a population level, we've already attained a certain level of protection. So it's either through our natural infection or through vaccination. When you take that into account, when one is exposed to the virus, um, they would not see progression of the disease to a severe form, um, or to need oxygen and so forth. But when the World Health Organization cautioned against treating it as a mild form, they had taken into account the it's the large proportion of the population who are not protected. When you look at other countries on the African continent and so forth, you'll find um, that there's a large proportion of them that have not been exposed or they have not been vaccinated. But when you look at South Africa in particular, only 27% of our population um, are fully vaccinated. So I think it's critical that we do not overlook this and that we treat it as a mild form of the disease, because when it reaches those who are not protected, we'll see a severe form.
So you bandied about the figure of 27% in South Africa of the population being vaccinated. Clearly, that's not good enough. Are you worried? And how is the current rollout of the vaccination drive going in South Africa?
There's much room for improvement. And in the festive period, not many people were presenting themselves to the vaccination sites. And I think that it was understandable because it was a period to be resting, and it was a tough year, 2021. But we now need to scale up our efforts, our vaccination efforts, because we currently administer about 60,000 doses per day. Yet, we have the capacity to vaccinate about 400,000 people per day. So, um, I think by now we would have wanted to have vaccinated about 70% of the population. Um, but the vaccine rollout, it's a massive project and it has its own challenges. Some could be attributed to the vaccine hesitancy that we see, but I think this is where the duty falls on the healthcare professionals, particularly on the front line, who have to advocate for vaccine acceptance. And I think also with the policies around mandatory vaccinations, we'll also see an increase in the coverage.
Inshallah. Do you think repeated booster shots will be the way to deal with the pandemic? Um, there's also the consideration that some people who are vaccinated are still testing positive. Is this a concern? And I'm kind of wondering about what is it, knowing how dire the situation has been up to now, what is preventing people from accepting the vaccine? I know you have the anti vaxxers and you have people who have a whole host of reasons, religious and other reasons for not accepting the vaccine. But the critical, the critical question here, what would that be?
That's a good question. It's a key question, and so a booster shot that is definitely needed because the studies have overwhelmingly shown its safety, but more importantly, its efficacy in light of the new variants such as Omicron. So Johnson and Johnson, a booster is taken after 2 months, and with Pfizer, the booster is taken after 6 months. These are needed because immune protection from Pfizer drops as low as 50%. And another study showed that your immune protection is only 30% after 6 months of your second dose. But with Pfizer, your immune protection increases to 88% after a booster dose.
Wow.
J&J, it shows a protection of 84% after your booster dose. So I think yearly we may have booster doses to be given, but that in itself has its own challenges because it may not be feasible, it may not be sustainable because the cost, together with the resources that has to be given to these booster doses, they are quite significant. But also the World Health Organization has also they've brought into light um, that the immune system, so it may be weakened with with these repeated or these constant booster doses. But for now, that's in theory. So just one booster dose is approved, and you are highly encouraged uh, to take it.
However, there is speculation that we'll soon enter the endemic phase, which would then mean we'd have to, like the flu shots, we'd have to have a booster shot or a shot on a regular basis, an annual basis, against any other variants that might come around.
Yes, that's quite interesting because it's now a new phase in how we view COVID-19. And we've always seen that it's an international issue, in that there's transmission on a global scale. But now, when we say that the disease will be endemic, we mean that it will always be present in a certain region or in a certain population. And so, what happens in other parts of the world, they won't affect what's happening here. And this is what 2022 may look like. Endemic diseases, they are quite rife in some areas of the world. For example, malaria, it's endemic in Central Africa. HIV in, in sub-Saharan Africa. And we've got influenza, um, we've got hepatitis B. So I think if COVID-19 has to now become endemic, which is likely to be the case, it's a long term solution to be living with the virus and that no harsh restrictions would be needed because 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 when you look at the severity of the disease, that won't be as bad as we had previously seen.
Inshallah. Mohamed Hoosen Suleman, shukran so much for your insights. It's really it's been an interesting discussion. I really loved chatting with you, and inshallah we will talk again with you sometime in the future. By the way, once you qualify, what are you going to specialize in?
Well,
I
I
had to
think
ask that.
I would want to go in surgery as a cardiothoracic surgeon, but it's a long way from now. I have to do my homework in the various fields. Yeah.
Inshallah, our du'as with you that you do make it, you do realize your dream as far as your career going forward is concerned. Undoubtedly, it's going to be great choices that you make, and you will be serving the community very well in uh, whichever path you decide to take. That is, of course, in medicine. So go well. Shukran once again for chatting with us, and salamu alaikum to you.
Wa alaikum salam. Thank you so much for the invitation and, of course, for the kind words. Please stay safe.
And you, Mohamed Hoosen Suleman, talking to us about 2022 and COVID-19. It is exactly 9:38 a.m.